Good evening, and thank you so much for being here with us today. I am so excited to be here at Gethsemane SDA Church, and thank you to Pastor Austin Humphreys, who has worked so hard and partnered with Wake County Health and Human Services for food distribution, COVID testing, and vaccination clinics throughout this pandemic. We are thrilled to be here tonight to answer your questions about COVID-19 boosters and monkeypox vaccines. We are happy to have students from Gethsemane Church who are here today to ask some questions live, and we will be fielding your questions from YouTube and Facebook. So let's get started. I'm Dr. Rasheeda Monroe. I'm a pediatrician with Wake Med. I'm a medical educator with the UNC School of Medicine. And I am here today with two of my physician colleagues who I will introduce in just a little bit. But first, some background information. Due to historical and structural factors in the United States, Black and African American communities have disproportionately faced several contributors of health, such as lack of transportation, low income levels, and lack of healthcare coverage that may decrease their access to health services. And we've seen that throughout the pandemic, these inequities have caused Black and African American communities to experience higher rates of poor health outcomes and disease as compared to their non-Hispanic white counterparts. In addition, the pandemic has heightened the stigma and distrust that African American and Black communities have faced with the healthcare system. Many communities share concerns towards the newly developed vaccines and booster shots. In order to combat these issues, public health agencies and officials have been working to build trust and build relationships with local community members, sharing critical information about COVID-19. Wake County Health and Human Services has been working throughout this pandemic with community-based organizations to increase health literacy and promote safe practices regarding COVID-19 vaccines and developing boosters to protect their health. However, despite these efforts, according to the North Carolina DHHS vaccination dashboard in Wake County, only 57% of African Americans and Black residents have received at least one dose of COVID-19 vaccines, compared to 65% of their white identifying residents. In addition, although Black Americans in North Carolina make up 20% of the county's population in Wake County, they've only received 16% of the vaccines. Moreover, with the start of the new school year, many children and adolescents are being exposed to the different variants of COVID-19, and parents are faced with another year of making decisions for themselves and their family to keep their children safe in this continued public health crisis. Many community members have questions about the most recent boosters, as well as monkeypox vaccines, and whether it is the right choice for their families. So we are here today to help answer your questions with factual and up-to-date advice to help protect your family and community during this ongoing pandemic. I would like to start by introducing my colleagues. I will start with Dr. Jamila Fletcher. She is a managing partner and pediatrician with Raleigh Children and Adolescents Medicine. Dr. Fletcher, can you just introduce yourself a bit and let us know anything about you that you want us to know before we get started?
Yes, Dr. Monroe, thank you. Can you hear me okay? Okay, awesome. Well, I'm very excited to be here to answer the questions that the community has online and also there live with you at Gethsemane Church. As you said, I've been a practicing pediatrician for 15 years now in private practice. So even before COVID, I was giving vaccines for things like measles, chickenpox, flu for over a decade. So I'm very familiar with vaccines in general. And then for the past 2.5 years, I've been testing patients on a pretty regular basis, if not daily, for COVID, counseling about exposures, counseling about home care if they are infected. And then thankfully, now that vaccines are available, we've been able to vaccinate our patients as well. So that's kind of the medical side. As a parent, I have 3 sons, from college age to elementary. So I can identify with parents out there who've had to deal with illnesses, had to deal with testing over the past 2.5 years. So I'd be happy to answer any questions about that, as well as I think my personal interest and personal anecdote I'd like to share with everyone is because of the two roles that I have as a parent and a pediatrician. I felt it very important to do my part by volunteering in the vaccine studies in the beginning. So I was one of the first thousands of people around the world actually who participated in the first phase 3 study. And because my youngest decided he wanted to do the same. So we are huge advocates of vaccines, and I'd be happy to answer any questions. And there's no question that is off limit. If you are hesitant, let's talk about it.
Awesome. Thank you so much for that introduction. And thank you for volunteering yourself to science for our benefit in that vaccine trial. We really appreciate that. Dr. Stephanie Etienne. Dr. Stephanie Etienne is the Interim Medical Director at Wake County Health and Human Services and family physician. Dr. Etienne, can you introduce yourself and let us know what should we be thinking about as we're moving into this season around COVID vaccines and boosters?
Thank you, Dr. Monroe. It's a pleasure to be here today. As Dr. Fletcher mentioned, we've all been on the front lines with the pandemic. And, as parents, we have children, we've dealt with illnesses, and we've had to just kind of rally and be there for the community at the same time. We've made quite a bit of progress, as was mentioned before, as far as vaccines and boosters. We're seeing fewer cases of COVID and as well as deaths. However, as we know, the pandemic is still in existence. And unfortunately, with looking at marginalized communities such as African American and Latinx communities, we're still seeing a disproportionate number of cases of COVID as well as death due to COVID. Thankfully, we do have the vaccines. And now that we have the boosters, we have an extra layer of protection against serious illness related to COVID. Unfortunately, in addition to COVID, we're dealing with an outbreak of monkeypox. Monkeypox is not a very deadly disease. However, it still impacts people. It is a condition that nobody really wants to have as far as the symptoms that are related to the virus. And unfortunately, just like COVID, it is affecting our minority communities, in particular, the African American community disproportionately. So I'm very excited about talking with you all today about what that entails and what we can do as a community to decrease the incidence of both of these illnesses and keep our communities healthy.
Well, let's go ahead and get into it. So first, I'll start with Dr. Fletcher. The new COVID booster vaccines are available. Maybe you guys have heard about it. Dr. Fletcher, start us off and remind us who should get vaccinated with this new booster vaccine and what are they being protected against?
Great question. So the new bivalent booster, let me just explain bivalent, meaning that it's going to protect from 2 strains. You guys remember in the beginning, the original strain of COVID-19, and then there was Delta. So this is going to protect from the original Delta, Omicron, which is what is prevalent right now. And there are 2 strains of Omicron, so BA4 and BA5. And this is why this is so exciting for us as healthcare professionals, because before this booster, the Omicron variant had changed so much from the original virus that the vaccine efficacy started to fade. So now we have another tool in our toolbox that can help us protect not only from original COVID, Delta, but also this new Omicron strain that's been dominant for about a year now. And then to answer your question about who should get it, it is currently available for anybody over 12 and older. So we do recommend that. And I want to just preface too that in the summertime, it probably doesn't spread as much because we're doing a lot of things outdoors. But in the wintertime, we're going to be closer together with holidays, just more indoor activities. And so this virus loves that situation. So it's going to be spread easily in the winter. So if you want to protect yourself, your family, high-risk family members, your pastor, your friends, this is going to be the best way to do that this winter.
Okay, so thank you for helping us understand what this bivalent booster means to us. So one thing that is exciting to me is that for the past year, we've had Omicron variants circulating in the community, but this is the first time in over a year that the science has caught up with the virus, right? So we can actually help protect people against the virus that's circulating. So I'm really excited. Anyone 12 and over can get that booster. Dr. ATN, can you help us remember what's the timing on that? So when should people get that booster? Like how long after their last COVID shot or the last time they had COVID infection? What do we need to think about from a timing standpoint?
As far as timing, if you've had both of your primary doses of the COVID vaccine, you can get the booster 2 months after the last dose of the primary series. Or if you're someone who has been up to date on your regular boosters, you can get that, the new bivalent booster 2 months after your last booster. And for any of the COVID vaccines, the previous vaccine as well as the boosters, for someone who has had COVID recently, you can get the vaccine as long as you've pretty much returned to your baseline state of health and your symptoms have improved. You don't have to wait a certain amount of time.
Okay, so that's helpful. Now I understood, is it right that 3 months is preferred after you've had COVID infection, that they prefer that you wait 3 months to make sure that the bivalent booster works well, or what are you advising people at this point?
You mean as far as post-infection?
Post-infection.
Well, if they're healthy, the COVID infection, you do have protection pretty much for 3 months after an infection. So it would be appropriate to wait that amount of time. But if you got it earlier, it would not necessarily decrease the efficacy.
Okay.
Of the booster.
So this is one thing that was a little bit confusing for people who completed their primary series. That's 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of J&J. If you've completed that, then 2 months after that, you're eligible for the booster, the new bivalent booster. What about people who have already had booster? You know, they've had dose 3, they've had dose 4, they're over 50 years old, they've already had both of those boosters. Can they still get the bivalent booster?
They can and should, because as Dr. Fletcher mentioned, the bivalent booster is what's going to provide protection against those Omicron subvariants.
Okay, got it. So everybody 12 and up, if it's been 2 months since their last dose, whether that was the primary series or their 4th shot, whether, you know, that was their 2nd booster, if they're over 50, they're eligible and should get the bivalent booster.
Most definitely.
Perfect. That's very helpful. What about side effects? We'll go back to Dr. Fletcher. What type of side effects should we expect? With my, 1st and 2nd Pfizer vaccine and my booster, I had a sore arm. I had a headache after one of the doses, felt a little tired. What should I expect when I get my booster?
So I would say most people may not have any reaction, but 25% may, for 48 hours, so a day or two, feel fatigued, headache. It's possible that you could have a low-grade fever, but that goes away without treatment. You could give ibuprofen or Tylenol, anything over the counter that you would use for pain. You could use that, and that should help. But don't be concerned that there's something wrong with the vaccine if that happens. If anything, it's a sign that your immune system is responding in a way that will protect you from the real virus should you be exposed to it.
Okay, perfect. So about 1 in 4 people will get symptoms similar to what they may have had with the first doses that they'd received. Headache or feeling tired, achy arm, low-grade fever. And that's normal and expected. That's a sign your immune system is working. Okay. What do we know about, for me, one thing that I had been keeping an eye on was the myocarditis risk. So as you all know, I have 2 boys. They are now 12 and 15. My 12-year-old, like your youngest son, Dr. Fletcher, participated in the Pfizer study also. But as we were vaccinating teen boys, adolescents, we were seeing this signal, a little bit of an increased risk of myocarditis in that age group. It was still one, or maybe it was, I want to say 10 to 20 per million. So in the scheme of things, low, relatively low, but when you have a teen boy, of course, you're going to think about that even more, be more cautious about that. But what are we seeing or expecting to see from that standpoint with the bivalent booster? Any concern there, or we expect to see the same?
I do not have any concerns about that. And I would just say that rare instance from a vaccine-related inflammation of the heart, which is what myocarditis is, all of those cases were self-resolved. So there were no deaths associated with that. And the actual virus itself was known to cause a more serious form of heart inflammation, myocarditis, even cases that were in the ICU and death as well. So when you look at the risk of heart issues, the virus is much more riskier than the vaccine. Mm-hmm. And if you happen to be the 10 in a million cases, they are self-resolved.
Okay. Thank you for reminding us of that. I found that very helpful when I was looking into this deeply a year ago when my children got vaccinated, that there was a higher risk of them having heart inflammation if they got COVID and they weren't vaccinated than getting from the vaccine. So that's really helpful. One more question for you, Dr. Fletcher. What about people under 12? Are they eligible for this new bivalent booster? And what should we be doing for our kids under 12 to keep them protected?
So at this time, children under 12 are not eligible for the new and improved bivalent booster, but they can get the original booster 5 months after their 2-dose series. And that's what I would recommend to protect them this fall and winter. And those who are in the household over 12 should go ahead and get the bivalent booster to protect their younger siblings and any high-risk children in the house.
Okay, perfect. I'm sitting here thinking my kids, they've just restarted school. We're in high school, we're in middle school. We're in middle school now. Many of the students, I would say most of the students are not wearing masks. Masks are optional. And so we're going into this fall flu and COVID season. We expect to see a peak, a bump in the cases. And we need to go ahead and get our boosters done so they can get their protection as we're going into that for the school year. Is that what you're thinking?
Definitely. Like you said, in the beginning, we had everyone was masking. There was a period of a shutdown. That is no longer happening. So, we're going to basketball games, indoor activities, holidays, for the most part, unmasked. So Omicron is going to be rampant if we don't get vaccinated. In fact, but if we can increase our rate of this bivalent vaccination in our community, we definitely know that we can save lives and we can decrease hospitalization. Because the last thing we need is for us to overwhelm the healthcare system, in addition to flu, which is also spread without a mask.
Perfect. So Dr. ATN, then this question is for you. We are just talking, it's flu season, it's COVID season. What about getting both vaccines at the same time? Do I need to be worried about that? Can I go ahead and get my flu vaccine and my COVID vaccine at the same time? Do I need to space them out? What do you think?
Well, both vaccines are considered safe if they're administered at the same time. You don't have to wait. Some people opt to wait because they're concerned about side effects, because you may have a higher immune response because you are getting two vaccines at the same time. So you may have, a little bit more achiness or more likely to have a fever. And it's perfectly fine if people want to wait a week or so later to get the other vaccine. But it is safe. There are no contraindications to getting both vaccines at the same time. It's done every day, and there have not been any adverse effects by administering both together.
Okay, so I'm thinking if I'm going to be achy for 1 to 2 days, I just want to get it all over with and get them both done at the same time. What do you think about that?
I think that's a good idea.
Okay, all right. I'm going to make sure that the students have an opportunity to ask some of their questions. So students, why don't you go ahead and come line up and start getting some of your questions answered. As we're doing that, I want to remind everyone who is listening and online to please complete the Health Lit for Wake survey. It is in the chat on Facebook and on YouTube. And if you would complete that for us to help us understand some of your needs and questions and concerns in the community, that would be really helpful. The Health Lit for Wake survey. So why don't you come on this side of me right here, come on down. And first, let me know your name and what grade you're in, and then let us have your question. Thank you, Isabella. Welcome.
What can you tell us about the new
Okay, so let's clarify this. This is for Dr. Fletcher, and you may not have heard her, so I'll repeat it. Isabel in the 6th grade wants to make sure. She's like, I already got my vaccines. I already got my booster. Do I really need to get this Omicron booster? So remind us, Dr. Fletcher, is this for Isabel, who is 12 years old? Are you 11 or 12? She's 11 and she's already had her shots, her 2 doses and her booster. Does she need this booster?
As soon as she turns 12, I would like for her to get this booster because, as we said, Omicron is the main variant that's predominant in the community for over a year now. So if she wants to protect herself and her family as much as possible, as soon as she turns 12, she needs to get this new and improved booster.
And I would like to add something as well. There are current ongoing studies with the bivalent booster in children under 12. So hopefully in the next few months, we'll have the bivalent booster available for those children as well. So that's something to look forward to.
Okay, perfect. Thank you so much for answering that question for us. Do we have another student who has a question? Awesome. All right, so first, I want you to say your name and the grade that you're in, and then read that question.
My name is Kenan, and I'm in 7th grade. And the question is for Dr. Fletcher. The question is, what can you tell us about the monkeypox vaccine? Should I worry about getting
That is an excellent question. Tell me your name again. Kaylin Spence in the 7th grade. Wants to know, I don't know if you guys could hear that, Dr. Fletcher or Dr. ATN, either one of you grab this question. Should she be worried about getting the monkeypox vaccine? What about her peers? Does she need to get vaccinated against monkeypox?
I can answer that. Currently, she shouldn't really worry about being vaccinated against monkeypox. Right now, there are certain more high-risk individuals who are eligible for the vaccine. The best thing to do is to avoid people who potentially have symptoms related to monkeypox, which is usually a rash, fever, body aches, and such. What we're seeing with monkeypox, currently the highest incidence of cases of monkeypox are in people who are men who have sex with men. It doesn't mean that they're the only people who can get monkeypox, but currently 98% of those cases are in that demographic group. But having said that, this is not something that can't affect others. Anyone can get monkeypox. If you are around someone who has lesions and you touch those lesions, if you are around them for a prolonged period of time and you breathe in some of their respiratory droplets, you have the potential to get monkeypox. So it's not something that most children have to worry about, but you still have to be safe and be cautious about, who you're in contact with, physically, and just be aware. So it's not something at this time that she should worry about as far as being vaccinated against monkeypox.
So as a parent of younger children, are you changing your life in any way as it relates to monkeypox in your children? Or is it just hand washing and avoidance of people if they have, suspicious or rashes? Or are you doing anything differently?
Nothing differently. I think now we're in a time where we're cautious, and we should be. We probably should have been this way before, as far as being judicious about hand washing, staying away from people when they're sick, staying home when you're sick, and just being cautious about any disease. So nothing beyond what I would do if my children potentially were exposed to somebody with flu or COVID. Nothing really beyond that at this point.
Or even chickenpox. And so many of us haven't seen that in so long. Yeah. But the same precautions we might take, right? Yeah. If someone had chickenpox. Excellent. Thank you for that. Is there another question from a student? Awesome. Okay, so state your name and your grade or.
Hi, my name is Justin Kelly. I'm a senior in high school.
Congratulations.
My question is for Dr. Fletcher. Will we be needing the COVID vaccine every year moving forward?
That's an excellent question. I think we all have been wondering that. What are you thinking, Dr. Fletcher? Is this going to become an annual thing moving forward? We've had these boosters kind of come out at random times throughout the past 2 years. What do you think?
Yes, I do think, unfortunately, COVID isn't going away anytime soon. And the more it circulates, the more it mutates. And you know what else does that? Flu does that. There are a lot of similarities. So it's looking like this is going to be an annual booster that we get. The experts, at the CDC and the FDA will kind of monitor the prevalent strains that are going around the world and decide which strains will be in future boosters. But for now, it's looking like we're going to have to learn to live with this. And the best way to protect ourselves every year, just like a flu vaccine, will be a COVID booster.
And that makes sense. And I think we're all used to our yearly flu vaccine. So the idea of adding this to our annual vaccines, that makes sense. So we have a question, a statement coming in from Facebook. Thank you, Jennifer Eldred, for your comment. The president said the pandemic is over. Dr. ATN, I want to send this to you. What does it mean to be in a pandemic versus something being endemic? And is the pandemic over? And does that mean that we no longer take precautions? Help us understand the difference.
Well, with the pandemic, there is a certain percentage or number of cases that of a particular virus that is having a significant impact on the health of the community. With the COVID pandemic, of course, we're still in a pandemic, I'll say that much. Things are not as bad as they used to be. Our case numbers have decreased significantly. We're pretty much on the verge of not being a pandemic, but we're not quite there yet. And there are specific numbers that the epidemiologists look at, cases per a certain number of people in the population to determine exactly when we're out of the pandemic. We have some really great indicators that are suggesting that we're close to being back to a state of what we call an endemic, meaning that the disease is present, but it is not having a significant effect on the health of our community. So we are still there, almost out of it, but we're still pretty much in a pandemic situation right now. We're not seeing as many deaths. People aren't getting as sick, thankfully, due to the vaccines and boosters, but we are still in a pandemic.
And if I could agree with Dr. Etienne and just add that just some perspective, there are still 400 deaths a day in the US. So if one of those is your family member, this does still feel like a pandemic. And this is why it's important for us to stay on top of it and boost our immunity as we go into the fall and the winter.
Thank you both for helping us understand that. And Dr. Fletcher for adding that additional bit of information. 400 deaths a day in the United States is not zero as it relates to COVID. And certainly if it's your loved one or someone that you know, then that feels pretty close to home and personal, and it feels like the pandemic is still with us. But just like when the flu virus is endemic, it's with us always, we still protect ourselves every year by getting our flu vaccine. So even when we go from pandemic to endemic, because the numbers have decreased with COVID, it will still be important to continue to protect ourselves. So that's helpful, I think, to remind the community. We also know that in the fall and winter, as we're inside more in crowded spaces and sharing our germs more, the rates of cold and flu viruses increase. I saw this interesting kind of data point that if we were able to get people vaccinated with this new bivalent booster by Halloween at the same rate that people got vaccinated against the flu last year, we would save 100,000 lives and 1 million hospitalizations across the United States. And so as a pediatrician, for me, that's been a bit of a call to action that we're trying to get people their bivalent booster by Halloween so that we go into this fall and winter season with an increased level of protection for our families and communities. Awesome. I think we have another question from a student. Say your name and your level of training.
Hello, my name is Siobhan. I'm one of the medical students from UNC that's working with Dr. Monroe. This is a question that has been posed, especially for a lot of our pregnant mothers who there's very little to know about COVID and what to do. So the question is, for those that are pregnant, is the COVID vaccine safe? And if so, when should I get it during pregnancy?
Excellent question, Siobhan. Thank you so much. And Dr. ATN, I will hand this question off to you. Should pregnant people get vaccinated? And if so, when?
I'm very, very happy to answer this question. I will say unequivocally, yes, 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 they should be vaccinated. Pregnant women are one of the most high-risk groups as far as developing significant complications as well as death due to the COVID virus. Because during pregnancy, your immune system is suppressed. So you are at more risk for developing complications. As a physician who cares for pregnant women, as well as newborns and children, I have unfortunately seen deaths due to the COVID virus as far as pregnant women. And this was something that could have been avoided with vaccines. The American College of Gynecology recommends the vaccine in pregnancy, and the vaccine is safe in pregnancy. There's no time where the vaccine is considered unsafe. The best time is to get it before you're pregnant and during the pregnancy as well. So anytime during the pregnancy, it's safe for a mother to get the vaccine. And the wonderful thing about that is when the mother is vaccinated, the unborn baby will receive some level of immunity from the mother that is vaccinated. Because as you know, the baby, when the baby is born, the baby will not be old enough to be vaccinated. So we see protection in that sense as well. And also in mothers who have been vaccinated who are breastfeeding, they pass on antibodies through their breast milk to their newborn. So the vaccine is a win-win for both mother and baby. So yes, definitely, these mothers should be getting vaccinated, and they can feel confident and know that it is safe and highly recommended.
And
Excellent.
Dr. Monroe, if I could just add a little bit from a pediatrician standpoint, there was some new data that showed that 84% of babies, the ones that Dr. Etienne are talking about before 6 months of age, before they can be vaccinated, 84% of babies hospitalized with COVID were born to moms who were not vaccinated. So not only is this going to protect the pregnant mom, this will protect the baby before the baby can get vaccinated. And not to mention the complications from COVID that can affect your pregnancy. So the, babies are more likely to be born premature or have serious complications, including stillbirth if mom gets COVID during the pregnancy.
Wow, thank you for adding that information, Dr. Fletcher and Dr. ATN. I hear a resounding yes, get vaccinated if you're pregnant, not only because it can help save the life of the mother, but also it can really help protect the infant. Infants aren't able to get vaccinated until they are at least 6 months old. And so by getting vaccinated as a pregnant woman and breastfeeding and continuing to pass on that protection in your breast milk, it helps to protect their babies. So that is really, really helpful. Thank you. All right, we've got a couple of questions coming in through the chat. First question is from Gladys Walton. Gladys, thank you for participating tonight. And this question is for Dr. Fletcher. Gladys has a son and a friend who will not take the flu vaccine. What can Gladys do to encourage them to protect themselves? And I know that you've had this conversation many, many times as a pediatrician and an advocate. How can people help encourage their loved ones to get vaccinated against the flu or COVID for that matter?
Well, as a pediatrician, I often start off with whatever hesitancy or misinformation they may be, that may be causing them to be worried about it, and just address them honestly and truthfully. It always helps to have a relationship with someone, though, when you're having that, so that it's a trusted advisor, trusted messenger, as we like to call it. And then I've also noticed that people are more willing to do things for others that they may not do for themselves. So a lot of times I will bring up the point that, grandmother has diabetes, or your favorite teacher has asthma, and you're doing your part to keep them healthy. And after answering questions and reassuring them, providing the data that they need to feel more confident, usually patients do come around, and I think your friend would listen as well.
Thank you. That's so helpful. We have another question from Chevelle Parker on Facebook. Thank you, Chevelle. Dr. ATN, this question will be for you. Chevelle says, many of my peers and family members are COVID vaccine weary. After taking the first booster, they have decided not to take any further boosters. Are there remaining benefits after taking the first 2 COVID shots at this point? Is there a reason to keep getting vaccinated, Dr. ATN?
There's definitely reason. As we mentioned, we know we're still dealing with the Omicron subvariants, and the original COVID vaccine does not offer much protection against those variants. And this virus is ever evolving, it's mutating. We don't know, along the line, there may be a new vaccine that comes out to that is more effective against future variants. So we have to really listen to the science and take advantage of what's available to protect us at any given time. Just as with the flu, each season the flu vaccine changes based on the strands of flu that are predicted to affect us during that season. So we have to adjust and make changes to the vaccine in order to protect us. So it's prudent to get the boosters when they're available, because they are tailored to protect you against whatever variant is out there that could potentially harm you.
Thank you. I thought it was particularly helpful information that recently the CDC showed or released, that people who are over 50 who were vaccinated and up to date with their boosters were 14 times less likely to die of COVID than those who had not been vaccinated at all. But you can see how that trend line would increase with a dose, with 2 doses, with their booster. And so additional protection was being given from the booster doses. And so we anticipate that same thing to happen with the additional protection from the Omicron variants BA4 and 5. So thank you for that. That's helpful. Next question is from Rahim Mufasa. Rahim says, my parents said that if I get vaccinated, I will not be able to produce sperm later to have children. Is this true? Dr. ATN, I'll send this back to you. Any concerns about male or female fertility, ability to produce sperm or have children as it relates to the COVID vaccine?
To date, there has been no evidence that the vaccine affects male or female fertility. It doesn't affect sperm count. It doesn't affect a woman's ability to conceive, or it doesn't affect her eggs in any way. So it is safe to get. I wouldn't, people say things, they see things online, or they hear, anecdotes from family or friends, but we have to look at the science. And the vaccines have been in existence for almost 2 years now. And we see that, they look at the effects of the vaccines, and there has been no data to suggest that it will affect production of sperm or fertility. One thing that we have seen in women with the actual vaccine as well as the virus, sometimes the menstrual cycle can become irregular. It can be more heavy, or it can stop. But what we've seen is that this is usually a temporary state. After a person recovers from the virus, or soon after they receive the vaccine, most people do return to their normal state of, their menstrual cycles return to normal.
That's really helpful. Thank you. We've also seen data that after getting the COVID virus itself, increased risk of miscarriages or even changes to fertility from the virus. So if anything, the vaccine would be protective against that. So thank you for that question from Rahim. Let's see. Dr. Fletcher, I'm going to send this question to you. Maybe it's a 2-part question about infants. So Sarah Dittmore from Facebook asks, is there a reason to get a 6-month-old vaccinated, even though the old vaccine doesn't cover the Omicron variants BA4 and 5? And kind of a follow-up question, if my 8-month-old baby has sniffles, should I skip their scheduled COVID vaccine until they're better? So 1, should a 6-month-old get vaccinated even though the vaccine available to them doesn't cover BA4 and 5? And should you skip the vaccine if your baby has a mild illness like the sniffles?
So, Sarah, great questions. The first answer, I would say a resounding yes. The primary series does not cover Omicron perfectly, but we do know it does provide some protection, especially from hospitalization. So I would say definitely yes. And then in order to be eligible, like Dr. Etienne said, they are currently doing studies on the younger age group for the bivalent booster. So in order to be eligible in the future for the bivalent updated booster, you have to have the foundation for the primary series. So you cannot just get a bivalent booster at this time if you've not had the primary series. So that's one reason to go ahead and get started with your 6-month and older children. And then the other question, can you repeat the other one for me?
If an 8-month-old baby is coming in for their COVID vaccine, but they have a mild illness like the sniffles, should they wait to get vaccinated until they're better?
I would say the sniffles could be COVID. So I'd reach out to your primary care doctor or pediatrician and get evaluated, possibly tested, just to make sure that you're not going to spread it to the healthcare workers that are giving the vaccine.
That's an excellent point. With the variants that are going around now, so many mild colds end up being COVID. And we see that as pediatricians all the time, don't we? And so first you'd want to get tested to make sure you don't already have COVID, that you're not a risk to other people in the daycare setting or at home, or and then getting vaccinated with a mild illness is recommended, and you can move forward when you know you don't have COVID. There are 2 more questions from students right here. 3 more questions. Fantastic. Okay, young man, come stand up here. I want to hear your name and the grade that you're in, and then your question.
My name is Timothy Wonder. I am in 2nd grade. My question for Dr. Fletcher is, what happens if the vaccine wears off?
That's an excellent question. Timothy, in the 2nd grade, just had a fantastic question. I hope you could hear that, Dr. Fletcher.
I did.
What
And
happened to
Timothy
the
did a wonderful job asking that question.
Yeah, he did.
So what happens if the vaccine wears off? We know that vaccines boost, or I should say, let me break it down. Vaccines help our body remember how to fight germs. So even as babies, we get boosters, and there's a schedule based on studies. The scientists tell us how often we have to get these boosters. So right now, when you get your vaccines, there's a schedule for when you get them. So Timothy said he's in the 2nd grade. So he is eligible to get the original primary series, and then 5 months later, he can get the original booster.
Thank you, Dr. Fletcher. We have another question. Can you come stand up here for us? Tell us your name, your grade, and your question.
My name is Stefanie Etienne, and I'm in 3rd grade. And my question is, how can I get my mother vaccinated?
That is an excellent question. Dr. Fletcher, can you hear that question? How can I get my mother vaccinated? Is that your question? That is an excellent one. What do you think? Is your mom, is she a little nervous about getting vaccinated?
Yes.
I see. What about you? Are you nervous about getting vaccinated?
Yes.
You are. Okay. So we've got a brave guy ready to ask a question, but a family that's a little nervous about getting vaccinated. What would you suggest, Dr. Fletcher?
I think first off, I really appreciate the question. And what I love is that you are worried about protecting your mom. I think that's so caring. And that's a great place to start. I think we all, like I said to another Facebook question, I think if you speak to your doctor, so your pediatrician, or your mom speaks to her doctor that she's been going to for years, that's a trusted person. So she would be able to feel more comfortable with the questions and the answers, that conversation that you have. And there's no question that's too small, no question that's too silly. Anything from, I'm literally just scared of needles. What can I do? There might be some things and techniques that your doctor can give you to help you relax and make it not seem so scary.
Thank you so much. I really appreciate that. We pediatricians, we deal with this quite a bit, don't we? Vaccines usually aren't anyone's like favorite thing, but we deal with it every day, kind of getting over the fear and anxiety. So thank you for reminding us of that. We have one more question, I think, from a student. Do you want to come on up and tell us you look like you're older than second grade. Tell us your name and grade and your question.
My name's Maurice McCullough and I'm a senior.
Congratulations.
I have a few friends who've had COVID in the past, like last year, and they're still suffering from like lack of taste or like a mild cough. Is that something that's normal, and are there any solutions to that?
That was a fantastic question. Thank you so much. Dr. ATN, I'm going to send this question your way. So the question, if you are able to hear, were you able to hear
Yes,
that?
I was able to hear it.
Go ahead.
Yes. So with COVID, it's not uncommon to experience lingering symptoms such as cough or congestion for weeks after the diagnosis. And as you mentioned, we also see people with symptoms like loss of taste or a sense of smell. Unfortunately, these symptoms can last longer than just the regular mild symptoms that you experience. Some people can experience these symptoms for months. The best thing to do in these situations, as far as the lack or decrease in your senses of taste or smell, is to do things to sort of kind of retrain the nerves that are responsible for those senses. So for example, if you're not able to taste as well, you should try to repeatedly eat things that are that have different tastes, like maybe sweet things, sour things, and sort of try to retrain yourself. And with the sense of smell a variety of things that are, maybe more bitter smelling, or things that have just different smells that can kind of retrain the neurons or nerves so that you can kind of regain those senses. If you're still having difficulty, there are special doctors who treat patients that have what we call long COVID symptoms. Long COVID meaning that you have symptoms that last months beyond the beginning of your actual diagnosis. So there are professionals who have become knowledgeable throughout this pandemic with dealing with these situations. So it would be good if those people are still dealing with these symptoms to discuss with their doctor. The doctor can give them suggestions, or if they need to, they can refer them to specialists who have gained more expertise with dealing with these concerns.
Thank you, Dr. ATN. Long COVID is a real thing, and we see it in children and in adults. And loss of taste and smell is really frustrating for a lot of people. It's so much of what we need to, eat and enjoy food and even protect ourselves. But people also might have, long-term issues with being very tired or short of breath, or even like brain fog, confusion and not being able to do and go about their daily business, do their jobs. We do see data that the vaccine and boosters help protect against long COVID. And so that is just another plug. Some people think, well, I'm not really at risk. I'm at high risk for severe disease from COVID. I'm young, I'm healthy, I don't have diabetes. But long COVID really can impact anyone of any age. And so getting vaccinated can really help protect you from that too. It is 7:57. We are close to out of time. I want to remind people to please look in the chat on YouTube and Facebook and answer the poll from Health Lit for Wake and help us out with understanding some of the needs of your community. And with only a couple minutes left, I would love to hear just kind of some final and parting words from Dr. Fletcher and Dr. ATN. We're very thankful for you to have joined us tonight, and what parting words do you have for families and communities about protecting themselves either from COVID or monkeypox during this time?
Well, I can start. I'd first like to say thank you all for participating, and the fact that you're here, you're wanting to gain knowledge to protect yourself and your families. The biggest thing I would say is if you're not vaccinated or boosted, please make sure you're vaccinated and boosted. As we discussed previously, is very important as far as your individual health and the health of your family and the community. And it's necessary for us to officially be out of the pandemic state. Sometimes it takes a family member or a friend to influence someone else to get vaccinated. So you do have influence, and take that extra effort to talk to your family members so that they can feel comfortable getting vaccinated. You may be the person that they need to hear it from. So you do have power, and please use that to help encourage people to get vaccinated, because it really will make a difference.
Thank you so much, Dr. ATN. Dr. Fletcher, any final words for us?
I also want to thank all the youth at the church and everyone online for participating, because these conversations still need to be had for COVID and vaccines in general, including monkeypox. So thank you for to Wake County team for holding this. And I guess my parting thought is I'm so glad that school is open, churches are open, we're kind of getting back to normal, but it wasn't too long ago where we all can remember where things shut down. And as we go into this fall and winter, I don't want us to get too complacent and forget that this virus is very smart, and it just takes one variant to make us take 2 steps back. And it can quickly evade our vaccines if we don't get boosted. And there's a reason why this is called public health, because what you do affects your neighbor and your friend and your teacher and the person at the grocery store. So let's all do our part so that we can stay open and happy and healthy this holiday season, especially as we get into the holiday season and we're going to be meeting with family. Let's do it in a responsible way, get vaccinated and boosted.
Thank you so much. That was perfect. As like our final parting words in our charge, I'm really thankful for all the church members who are here today, because you really are the ambassadors to your community. You have more access to your family and community than we ever will as physicians, and a lot of influence. And if you just think, your encouragement, your example, you getting vaccinated and boosted and taking your family and friends to do the same really can change the health and the trajectory of what this looks like in our community here in Southeast Raleigh, here in the Black community in Wake County and beyond. So you really are the heroes in this story. So thank you all so very much. Thank you to Dr. ATN and Dr. Fletcher for being here.